Good morning.
Good morning, everyone.
Good morning,
Good morning,
ma'am.
ma'am.
Okay,
Good
so
morning, ma'am.
good morning. So today, just for 5 minutes before we start this our topic, okay? So we will have like extracurricular activities, okay? So today, so is everyone ready for today?
Yes, ma'am.
Okay, Kyoda said she's ready. Okay. Okay, today whom will we request to sing a song? Anyone want to volunteer yourself? It's just for 5 minutes. It will not take more than that. Anyone prepare for it? Shoda, are you ready?
Yes, ma'am.
Okay, please on your video. Please on your video, Shoda. Okay, no problem. You like to dance or you like to sing? Shoda,
Yes, ma'am.
you like to dance or you like to sing?
Sing, ma'am.
Okay, no problem. Just for 5 minutes or how much you please sing for every one of us. You just need to sing. It's not that like you need to be like perfect. Just at least you try, nah? Sing for us.
Yes, ma'am.
Everyone, please listen to Shoda. Everyone, your turn will come. Okay, today is Shoda. Next time you all. So get ready.
Yeah, ma'am.
Okay. Take your time. Take your time. If if you feel uncomfortable, you can just off this video. So no problem. We can just hear your voice. Okay, you can start now.
Wait, ma'am.
Yeah, okay. One, two, three, start.
दिल चुरा ले ओ चाँद से चेहरे वाले दिल चुरा ले ओ चाँद से चेहरे वाले मुस्कुराने
Sing, sing. You can continue. You can continue, no problem. Brother, are you done?
No, ma'am.
Okay, you can continue. You can continue. One, two, three, start. Start. I'll join you. Okay, start, Kyoda. Are you done?
No, ma'am, no. Wait.
Okay, okay. Okay, as soon as I said 3, you start, okay? 1, 2, 3, start. Everyone listen to Kyoda. Okay, Kyoda, will you get ready for next time? Okay, Shilun.
Yes, ma'am.
Okay, next time you get ready. Okay, Shilun, now you want to sing a song?
Yes, ma'am. I'll sing.
Oh, yeah, sing.
Wait for 1 minute.
Okay. Do fast because the time used to be very less. So it's just for 5 minutes and we already wasted. Nah? So you just sing for like 2-3 minutes. It will be okay.
Okay, ma'am.
Okay. If you want, you can on your video.
Okay, ma'am.
Every one of you get ready, okay? In my next class. Again, I have class 9 in the afternoon. I have two class in the afternoon, your practical. So before that, again, I'll request someone. So just be ready. You get such a good opportunity to show your talent. So just utilize this opportunity. Okay, Shilanok, are you ready?
Yes, ma'am.
Okay, on your video so that we can see you performing.
Hello, good morning.
Morning. Okay.
The title of my song is One Day.
Okay.
I'm not that actually prepared, but let me just sing. Time's late under the moon. I thank God I'm breathing. Then I'm praying, don't take me soon, 'cause I am here for a reason. Sometimes in my days I drown, but I never let me get me down. So I negativity is around. I know someday it'll all turn around. 'Cause all my life I've been waiting for, I've been praying for the people to say that we don't wanna fight no more. There'll be no more war, and our children will pay one day, one day, one day, one day, one day, one day. It's not about win or lose. We are times when the freedom souls of the innocent blood drenched brave men keep on moving through the water, stay raging. In this May, you can lose your way. It might drive you crazy, but don't let it face. No way, no way. Sometimes in my days I drown, but I never let me get me down. So when negativity is around, I know someday it'll all turn around. Cause all my life I've been waiting for, I've been praying for the people to say that we don't wanna fight no more, there'll be no more war, and our children will play one day, one day, one day, one day, one day, one day. Thank you, ma'am.
Okay, thank you so much, Shilono. Please clap for Shilono. Very good, very good, very good, very good. Now we came to know that Shilono is the first singer among your class. So we will always request him. And the afternoon, again, we will try to find out the dancer, the singer again. Okay, so that was all about the extracurricular activities that we could perform for today, as there is like shortage of time now. So that's why we will now like continue with this topic for today. So as today you have the first aid theory now. So whatever like I have discussed that day, that is we have discussed about the bleeding, that is hemorrhage now. The remaining portion, like how much we can complete, we will be like discussing today. So all of you like take out your first aid copy and I'll show you all the screen. Okay, is the screen visible?
Yes, ma'am.
Okay, so.
Yes, ma'am. Yes, ma'am.
Okay, so let us this revise, okay, whatever we have discussed. That is hemorrhage or bleeding. Am I audible?
Yes, ma'am.
Yes.
Okay,
Yes, ma'am.
okay, so whatever we have discussed, let us just revise it, okay, with a rapid flow. Okay, so hemorrhage, okay, hemorrhage which was also known as the bleeding, that is the flow of the blood from our blood vessels, that is might be from the artery, vein, or capillaries. So, and we have discussed about the type of hemorrhage, right? First was the arterial bleeding, the other one was venous bleeding, and then the other one was the capillary bleeding. So that were the three, there were the definition and the types of hemorrhage, or else we call bleeding, okay, that we could find and we have already discussed. So today we will mainly focus on the next topic that is from your syllabus, that is special form of bleeding. So let us discuss what are the special forms of bleeding. So I'll be discussing one by one. So the first special form of bleeding is bleeding from the scalp. So every one of you know now what is scalp? SCALP, scalp.
Yes, ma'am.
Yes, ma'am.
Okay, so we will be discussing, okay, about the bleeding that occur from the scalp. So our scalp, okay, our scalp, it has many blood vessels, okay, it has many small blood vessels which is running very, very close to the skin surface. That blood vessel, it's running close to the skin surface, okay. That is why if any kind of cut, okay, if any cut or if any break it occurs, okay, it can lead to profuse bleeding. So as it is very close to the skin surface ना, ये जो हमारा जो scalp है ना, ये skin surface में बहुत ज्यादा close है, तो क्या होता है कि अगर छोटा सा cut होने से भी like it can lead to severe bleeding. Profuse bleeding का मतलब severe bleeding. So the scalp it has a many small blood vessels which is very close to the skin surface. Okay, so if any cut is occur in your skin surface, then it can result to profuse bleeding. So the severe bleeding, I mean. Then if there is any cut which often make a scalp wound appear worse than it is. So profuse bleeding means like this, it can, as it is very close to the skin surface, then it can worsen, okay? It can worsen, deteriorate the bleeding very fast. So in some cases, what happens is that a scalp wound may form part of a more serious underlying head injury, okay? It can also like lead to head injury, so such as a scalp fracture or may be associated with a neck injury. So for this reason, you should examine a casualty with a scalp wound very carefully. I have written down what I was trying to explain also, so that like there are some students now who can catch up things as easily, so you can just read it what I have given. So these are the like the bleeding that we can find from the scalp, okay, as there are very small blood vessels present over scalp, and then as it is very close to the skin surface, because of that, if any bleeding occur or if any cut occur from there, if the bleeding is like, if the flow of bleeding occur there, what happens is that it can worsen, okay, it can worsen, that is profuse bleeding. So this is all about the introductions about the bleeding from the scalp. We will discuss detail about this, okay, about the sign and symptoms, what to do if there is bleeding in the scalp, and what is the treatment, everything we will discuss, just the introduction. So coming to the next, the scalp wound bleed profusely due to. So let us see, this scalp wound bleed profusely due to what? Means scalp wound bleed severely, okay, due to what reason? Rich blood supply, because there are very like the supply of blood is very rich, okay, in the scalp. That is why it can lead to the severe bleeding. And then the skin covering the scalp is tightly stretched, because what happened is that like this scalp, it is very close to the skin surface, so the skin that is covering the scalp, okay, if it is tightened or if it is stretch out or if it's break, okay, then what happens is that it can like it can bleed severely, it can bleed profusely. So these are also the reason. अगर थोड़ा सा भी like स्काल्प जो हमारा जो स्काल्प है ना, वो स्काल्प का ऊपर में एक स्किन कवर करेगा, जो स्किन स्काल्प को जो कवर करते हैं ना, दैट पार्टिकुलर स्किन अगर स्ट्रेच हुआ ना, अगर स्ट्रेच हुआ और टाइटली स्ट्रेच हुआ, तो ज्यादा स्ट्रेच होने से क्या होगा, लाइक इट कैन ब्रेक ना. सो एज देयर इज अ रिच ब्लड सप्लाई इन आवर दिस स्काल्प, ओके, रिच सप्लाई ब्लड, रिच ब्लड सप्लाई होने की वजह से बहुत ज्यादा ब्लीडिंग हो सकता है, एंड दैट ब्लीडिंग कैन बी सीवियर, which is very dangerous. So and then when the damaged skin, when the damaged skin split open leaving a gaping wound, means like the particular skin that cover the skull, okay, if that particular skin, if it get damaged so much, the skin is damaged so much that it split or it break into pieces, it split out. Agar split out, then what happens is that it will leave a gaping wound. So obviously there will be a gaping wound because the skin that used to cover the skull, okay, if that particular skin is totally damaged, then nothing will be left out now. So it will just like, we will just leave it like that in an open wound, the open gaping wound, means the wound, in the wound there will be a gaping, there will be no skin to cover as it is totally damaged. So this is how the severe bleeding can occur. Number one was because of the rich blood supply, the other one because the skin covering the skull is tightly stretched, and the other one when the skin that covered the skull is totally damaged and is split out, and then if it's split out, it leaves a gaping wound. So wound में gap दिखाई देगा. So are you clear with this? Are you clear?
Yes, ma'am.
Yes, ma'am.
These are just the introduction, okay? We will discuss the sign and symptoms. So let us discuss the symptoms and sign. Okay, if there are bleeding in the scalp, okay, अगर scalp में bleeding हुआ तो क्या-क्या symptoms दिखाई देगा? What are the symptoms that you will find if there is bleeding in your scalp? So number one, there will be pain, there will be tenderness, and there will be bleeding of the scalp. These are the symptoms you can find. Okay, pain, every one of you know pain. Pain, pain means dirt. Okay, pain. And tenderness. What is tenderness? What is tenderness?
Softness, ma'am.
Anyone? Anyone else? Tenderness. Because if there is a bleeding in your scalp, now these are the symptoms you will see. So tenderness. Tenderness. Anyone? Anyone? Samson, what is tenderness?
Soft. Hello, ma'am.
No idea.
Soft.
Soft. What is it?
Ma'am, sensitivity of pain.
Yeah, sensitivity of pain. Okay, that is like partially correct. Okay, this okay, it is like a pain or any kind of like discomfort. Okay, when an affected area is touched, like when you touch the particular affected area, now where it is being affected or where it is being injured, if you just touch it, like you will find any kind of pain or any discomfort. So that is tenderness. It is slightly related with that of pain. Okay, it's you can't call it tenderness as pain, but any kind of discomfort or any kind of like what to say, any kind of irritation or anything, that we call it as tenderness. So this pain, tenderness, as well as bleeding. Okay, all these symptoms you will find. Okay, if there is a bleeding in the scalp. So the other one, smelling around the wound. So the wound, okay, the wound, there will be smell or the odor. We call it as odor. Okay, the smell, there will be like what to say, foul smell. Foul smells mean bad smell. There will be bad smell or foul smell. Okay, around the wound. These symptoms also you'll find. And possible symptoms and sign of scalp fracture. There is also a possible symptoms of sign of scalp fracture. Okay, scalp fracture bhi ho sakta hai. It is a possible symptoms. And the other one is sign of brain damage. So like there can also be a sign of brain damage. And the other one is unconsciousness. Unconsciousness means like the opposite of consciousness is unconsciousness. So there are about the sign and symptoms. So let us discuss what we need to do if there is a bleeding in the scalp. Okay, if there are any displaced flap of skin at the injury site. Okay, any kind of displaced flap, okay, of skin at the injury site, we have to carefully replace them over the wound. Okay, and we have to reassure the casualty. We have to reassure the or we have to inform the injured person. Okay, that you are removing the this or replacing the displaced flap of skin. जो इंजुरी का साइड पे जो डैमेज स्किन है ना और जो स्किन निकल रहा है ना, you have to do dressing, right? So what happens is that you have to carefully remove all those displaced flap of skin. All those you have to remove, and you are going to remove and perform this. You have to reassure the casualty. You have to inform them. So that if you inform, what happens is that it can help you in smooth dressing or smooth like functioning of any kind of dressing you perform. So next is you have to cover the wound, that particular wound. Okay, you have to cover the wound with a sterile dressing or a large clean gauze pad. Because if there is an excessive bleeding, what happens is that in order to stop the bleeding, you have to use a gauze pad. Understand? Because you have to apply pressure over direct pressure over there now. So you have to put a pad, gauze pad. That gauze pad is also the sterile one. So I have already shown you all in the first aid kit that how it looks like. So that gauze pad that you need to carry, and you need to apply that gauze pad by putting direct pressure upon the area, upon the affected area. Okay, in order to control or to reduce the bleeding. Okay, or to reduce the blood loss. And also when you reduce the blood loss or when you reduce or control the bleeding, what happens is that it not only stop the bleeding or reduce the blood loss, it also minimize the risk of shock, okay, the risk of this occurrence of shock. So this is the second point, what you need to do or perform when a person have bleeding over his or her scalp. Okay, so let us move on. Next, we have to keep the pad in place with a roller bandage to secure the pad and maintain pressure. So इसका मतलब है कि the pad, that gauze pad, now you have to apply the gauze pad over the wound, okay? Over the wound, you have to apply the gauze pad. And that particular gauze pad, what you need to do is that you have to like roll that pad, okay, with the roller bandage. Roller bandage से वो pads को gauze pad को roll करके cover करना है. In this way, you will secure the like this gauze pad. You will secure the pad. Otherwise, if you just put upon the wound, if you will just put the like gauze pad, what happens is that while you are moving and all, it will just fall down, right? It will just fall down. So, so in order to secure or prevent all those falling downs and all, you have to use this roller bandage, okay? And as well as you have to maintain the pressure over there. You don't need to tightly like tie it, okay? You have to maintain the pressure. So next, you have to help the casualty lie down with her head and shoulder slightly raised. That means you should help the injured person, okay? Lie down with her head. She will lie down with her head and her shoulders should be slightly raised, okay? The shoulder, just shoulder, you would slightly raise hona hai. And if she feels faint or dizzy or show any sign of shock, agar that if that casualty, if that injured person, if he or she feel pain, okay, she means she feel like fainting or is she's feeling very dizzy or okay, or if she show any sign of shock, then that you cannot do you cannot perform any primary treatment, that because that is the emergency cases now. So in that case, what happens is that if there is a nearby like a healthcare center, like a hospital, then you can directly refer or take the casualty, okay? But what happens is that if you are far away from the healthcare center, then you have to call 911 for emergency help, so that this 911 comes and then directly like transfer the casualty, okay, to the hospital. So and then as well as the first thing that you should always do is you should monitor and record the vital signs, okay? So you have to check the vital signs, means you have to check the like blood pressure, you have to check the temperature, you have to check the pressure, okay? The TPR that I taught you all that day, na? Temperature, pulse and respiration, all those things you need to assess it, okay? And then you have to check the level of response also, like you have to talk or you have to like call the injured person, okay? If he is conscious, then you just need to like talk with that casualty and you have to see the level of responsiveness, just whether he or she responds you or not. And you have to assess or monitor the breathing pattern, okay? If the casualty is having a shortness of breath or difficulty in breathing or not, all this you have to check. And you also have to check the pulse rate, okay? While waiting for help, you have to, while waiting for help means while you are waiting for the medical department to arrive. Now, all these first aid treatment or primary treatment, you can perform it. This is what you need to do. Okay. Jivan, please take attendance. Okay, and we have to like cover the wound with a sterile dressing or a large clean gauze pad, okay? And you have to apply it firmly and direct pressure on the pad to help control bleeding, to reduce blood loss and minimize the risk of shock. Same thing, you have to cover the wound with a sterile dressing or a large clean gauze pad. And when you apply those gauze dressing and orna, you have to apply firmly, means achhi tarah softly, you have to apply firmly, and you have to you have to apply direct pressure on the pad to help control bleeding, to reduce blood loss and minimize the risk of shock. Same thing, it is like repeated, the same thing. Okay, next, what should be your aim? Your aim should be to control bleeding, means like before the treatment, okay, before performing the treatment, you should have the aim. What is your aim or what is your goal in performing this first aid dressing? your aim should be to control the bleeding as well as to arrange any to arrange transportation to the hospital. Okay, or if any like nearby health facilities available, you can directly like refer to that. So this is what you need to do. This is what you need to do, and this is what like you should have an aim. Okay, and then let us see if someone have bleeding over his or her skull, then what are the treatment that you can perform. Okay, treatment, the first treatment is you have to control the what you need to do, and this treatment, don't confuse. Okay, it is same only, like you can write anyone, like the I have given you or not, this is what to do. You can write this, or else you can directly write this treatment. So you have to control the bleeding using direct pressure by dressing and bandaging, which we already discussed. And if the casualty is conscious, okay, because when you call his name, he could respond you. When you ask something, he could respond you back. That is known as conscious. So if the casualty, that is if the injured person is conscious, lay him down with the head and shoulder slightly raised. The same thing that I have discussed, and you have to check the breathing pulse and level of responsiveness at least 10 minutes interval. When that means don't forget this 10 minutes. Okay, now you have check the temperature, pulse, respiration, all these things. Now you have already checked now. Then after 10 minutes you have to check it again. Means 10 minutes interval you have to keep, that you have to keep on checking, because it can keep on changing now. So when you check at 1 p.m. it was like the BP was like 120 by 80, and after checking 10 minutes it falls to 90 by 60, like that. It can fluctuate. That is why you have to like check after every 10 minutes of interval. So the next is, if the casualty become unconscious, keep him in recovery position. So if he is unconscious, you have to keep him in recovery position. You have to do such kind of things that can make the casualty like recover. Okay, so and then if breathing and heartbeat stop, begin resuscitation immediately. So the breathing, the casualty might have difficulty in breathing at that time, like you have to keep on checking the vital signs. Okay, but if the breathing and the heartbeat stop, okay, begin resuscitation immediately. You have to like give oxygen. Okay, you have to give oxygen like through the oxygen pump. You have to give this, all this breathing. You have to begin resuscitation immediately. So resuscitation means like that, giving oxygen. Okay, that is externally you have to give the oxygen, like with the help of the oxygen pump or any like oxygen cylinder, whatever it is, whatever nearby, like whatever materials or items that is available nearby. So, and you have to ship him to hospital as a stretcher case. Like if there is an excessive bleeding, not profuse bleeding, so you have to ship him to hospital, okay, as a stretcher case. So these are the treatment that you can perform if the casualty have this bleeding over his or her skull. So are you clear, all of you? Are you clear?
Yes, ma'am.
Yes, ma'am.
Okay, if you're not clear, then you can just ask me. Okay, I want to like discuss more, but there is only 5 minutes left, so we can't discuss it more than this, because we have like wasted so much of time in that extracurricular. So next time in the evening class we will try to maintain, and the evening class all of you will try to attend. Okay, it is the practical class, and we will the theory portion I will check it out like that day, whatever I have given you all, like have I completed it or not. If I have not completed the theory portion, then I will like continue with the theory, and if the theory portion is completed, then I will start with the practical, and I will show you all the stethoscope, the sphygmomanometer and all. Also I will show you all practically, not the image. So are you clear, all of you, with whatever we have discussed today?
Yes, ma'am.
Okay, so there are so many special forms. Okay, so we will discuss slowly and steadily, because every day we have class of this. So Jiban, are you done with the attendance?
Yes, ma'am.
Okay, then that's all for this morning class. Okay, thank you everyone.
Thank you, ma'am.
Thank you, ma'am.
Thank you, ma'am.
Thank you, ma'am.